All right, today on the Bone and Joint Playbook, we're joined by a PT, physical therapist. Dr. Urse, what's in store?
We're going to talk about hamstrings and other muscle injuries today. We have Dominic DiMarino, a physical therapist, who's going to help us with our guidance on treatment and avoidance of this problem.
All right, tune in. We'll see you in a minute.
Welcome to the Bone and Joint Playbook with Dr. John Urse, where we explore an extensive range of orthopedic topics and insights. Our goal is to help you understand the available orthopedic options and treatments available, and hopefully give you some answers to questions you might have. We want to thank our following sponsors.
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. You can find Ted's in Dayton, Ohio at Dorothy Lane Markets, Health Foods Unlimited, and Dots Markets. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high net worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup@stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas & Company, Incorporated.
Hey, Dr. John Urse, we're back for another episode of the Bone and Joint Playbook. Welcome back.
Well, thanks, Terry. This is a special Halloween episode, not celebrated all around the world, but certainly in North America, where people dress up like witches and goblins and walk around and take candy from other people's houses.
So you're dressed up like a doctor, is that correct?
With a little orange. Orange is commonly seen with pumpkins, which are symbolic of Halloween in North America.
Well, that's true. We're going to get to this guy here in just a second. But before we do, let's go on the record. We have a dollar bet on the World Series tonight. You say it's going to end tonight. I say it's not going to end tonight, and the Dodgers will win. You say Blue Jays will win.
Well, you asked me 4 weeks ago who was going to win the World Series on a podcast, and who did I say?
I think you said the Reds.
I said the Blue Jays. So, there's been a few teams that have lost that Game 5 at home and come back on the road and won both games of Game 7 and 6 to win the World Series. But
well, you are a wealth of knowledge. But
they should try to win tonight, the Blue Jays. So you should watch it no matter where you are on the world.
So instead of ignoring our guest of honor here, why don't we introduce this guy? I'm going to try, Dominic DiMarino. Correct?
Got it.
I even used the little... Yeah.
From the motherland.
Dominic, what is it that you do that makes you worthy enough to sit in that chair and talk to us today about hamstrings?
I know this guy.
Well, a lot of people know that guy.
No, I'm a physical therapist, and I work in orthopedics and sports medicine.
Okay, and where do you, is it at Orthopedic Associates or?
Yeah, our clinic's right next to their facility, and I've worked with those guys now for 15 years.
So physical therapy is one of those mystery things to me. I get what doctors do. I get what surgeons do. But I'm not exactly sure what physical therapy people do. Do they come in before the surgery, after the surgery? What is the typical place I would meet you? Is it before or after?
Everywhere.
Oh, look at that.
Sometimes before, usually after.
But also many times to avoid surgery. So we had a podcast called 5 Reasons the Front of Your Knee Hurts. And 90% of those problems related to your kneecap have to do with muscle weakness, imbalances around the knee. Physical therapists can realign your muscles with the right exercises, the sports tape, and you don't even need surgery. So a lot of times therapists help us avoid surgery by using non-operative methods of their expertise to help you along with your injury. And then today we're going to talk about hamstring and other muscle injuries. So common injuries, so there's a preventative avenue we can go down, but certainly what do we do to treat it? Because there's a lot of pressure on not just the therapist, but the treating doctors and the medical team to get the sports athlete back on the field. The coach wants them, the owner wants them, the fans want them. But we're going to find out today that these are common injuries and they can't always be hurried back. These are tears in muscle, much like you'd cut a steak. And when you cut a steak to see if it's medium rare, the juices come out. That's what happens when a muscle tears. You get bleeding, and that immediately leads to pain. And that guy putting his hand up saying, get me out of this game because I can't run.
So can I ask a couple questions before we get into the hamstring thing about the PT? So you went into multiple years of schooling to become a physical therapist, correct?
Yeah.
Just describe what that process looks like. So for those people out there, they know what a PT actually is. And
Well, we're the musculoskeletal biomechanical experts.
that's pretty fancy.
Yeah. So we know all the joints angles, how the muscles work, and how they interact with different body systems. So 4 years of undergrad, go to a Doctor of Physical Therapy program.
Right.
That's usually 3 years. You sit for a big board exam, and really the limits are endless to what you can do. You can major in any, or you can focus on orthopedics, neuroscience,
Really?
acute care. Yeah.
So there's specialty in PT. It's just not one PT does it all. You have unique specialties that you go into.
Well, and we've had hand therapists on, so there's called occupational therapists. They
Right.
do mostly hand rehab
Yeah.
and upper extremity. Some of them do more of the lower extremity and larger joints, legs, backs, hips, and things. So, there's also a breakdown in most areas of medicine where areas of expertise are, geared toward.
So, usually sometimes when kids are young, they'll go, I want to be a doctor or a lawyer when I grow up. When did you realize that PT was what you wanted to do?
When I saw how long I was going to be in med school and how much debt I was going to have.
Good answer.
No, really, playing sports and a family member is a therapist, and just getting to know how the profession has so much independence. We can do literally whatever we want, from manipulations, hands-on manual techniques, strength training. There's really no limit to what we can do. Our practice act is pretty broad.
Okay. So today we're going to focus on hamstrings. And hamstrings, tell me what the hell a hamstring is, where it is, because I don't
First
know.
of all, we're sitting.
Yeah.
Our sitting bone is the bottom of your pelvis. Your hamstrings are muscles that on the behind the thigh, and they go from your sitting bone
Yeah.
all the way to the back of your knee, and they bend your knee. So those are the back knee flexors, they call them. And just like you have a thigh muscle in the front called a quad muscle to straighten the knee, the hamstrings bend the knee. What we find is that hamstring injuries are probably almost a fourth of all sports injuries in American football, soccer, basketball,
Really?
baseball.
Hamstring.
And these are extremely common. In fact, they're the most common injury you're going to see, more than these ACL injuries where everybody sees the ACL's torn or the Achilles is torn. Oh, my rotator cuff's torn. Let me tell you, if you have a team of 25 players, 5 of them will have hamstring injuries during the season, and that will amount to 80 lost games for that team every year. So these are common injuries. 90% of the injuries are going to occur to the hamstrings, so the back of the thigh,
Yeah.
the front of the thigh called your quads, the inside thigh muscle, your groin muscle, is called your adductors. They pull the leg in toward the other leg. And then the calf muscle is behind your leg, below the knee. The calf muscle is the other common area. So 90% of all muscle injuries in sports occur in those 4 muscle groups. But the hamstring is the most common. It's the one people hear about, but they don't know much about. I pulled my hamstring. So there's a few upper extremity things. One of the baseball players on the Blue Jays the other day, George Springer, was swinging and pulled a rib muscle. Well, that's above the waist, but not a common thing. The hamstrings are seen by people running, accelerating, stealing bases. We see it in soccer with kickers. In fact, your kicking leg is more commonly injured than the plant leg. And there are some dynamics of how we may be able to prevent these or certainly treat these that we want to get into today.
So let me ask Dominic a couple questions. So it sounds like the reason you're here and the reason this topic is on the agenda is hamstrings must be one of those things that are treated through physical therapy.
Mm-hmm. A lot.
More often than surgery?
More conservative.
Way more than surgery. And that brings us to, how do you know what's wrong? First of all, the guy puts his hand up, or girl, and says, I can't run. I feel like I got shot by a sniper. And when those muscles tear, they really hurt. You have to make a diagnosis. Sometimes you'll see bruising or bleeding, and you'll get a purple color, sometimes yellowish, but that's blood under the skin. And if it's a bad injury, remember we talked about cutting a steak and having the juices come out. That's why you should use a meat thermometer when your wife wants medium rare steak. Instead of cutting it, you should check the temperature.
But how do I determine if it's physical therapy is going to be okay or surgery is going to be okay?
Well, that depends on what's wrong with the muscle. So we have to get an imaging study done pretty quickly, especially a sports team. So if you're on one of the sports teams and you have an injury and you can't run, the coach is like, I need that guy to run. It's like, well, the doctor's going to say he needs an MRI. That's the most accurate test. It's a radio wave test. And the MRI is going to show you, fortunately, 80% of these don't tear the muscle badly. There's what's called edema or swelling. It's been stretched. 80% of the time, it's just a short recovery period, usually weeks, not always months. But if the MRI shows a partial tear, think of a paper that is ripped in half. That's a partial tear. If it's ripped completely down the middle, those are bad injuries. Those are fortunately very rare, but those sometimes do need surgery. And we talked about our sitting bone. If you reach on your butt, you can feel a bone there. That's called the ischium. It's the bottom of your pelvis. If the hamstrings, which are 3 little tendons, much like these fingers that attach like ropey structures, if they tear off the bone, sometimes those need to be repaired. Otherwise, you can have a career-ending injury if you don't repair a really bad injury. They call it an avulsion.
So Dominic, if I come to you and say, I have a hamstring tear, it's been evaluated, that's not requiring surgery, walk me through what you're going to do with me. And then are there things that somebody could do at home where they don't have to come visit Dominic? Are there simple things they could do if it's a minor, strain or something like that?
So the first thing we would do when you come to therapy is just evaluate it and kind of see.
How do you do that?
We're just looking at loss of muscle function. Are you weak? Are you losing range of motion at the hip and the knee? Because the hamstring crosses 2 joints. It crosses the knee and it crosses the hip.
Okay.
So you can have deficits in both of those, and usually you do. So check strength, check range of motion, check muscle flexibility, and then checking tissue irritability. So how swollen is it? How tender is it when you touch it?
So you push on it? You go,
Yeah.
Does that hurt? Does that hurt?
Yeah.
Does that hurt? Does that
Yeah.
hurt?
We can
Okay.
palpate and see how big is that area. Based on the size of that area, that kind of gives me a good idea as to how much damage there is.
Yeah.
Obviously how much pain they're having, and then kind of come up with a plan to keep them moving while allowing the tissue to heal without stressing it too quickly.
All right. Now you got me where I wanted to go. I've got the tear. You've seen me. You go, you got a hamstring minor tear. Walk me through my physical therapy. What am I doing?
How about if I tell you what you're not doing?
Yeah.
What am I not
Because
doing?
what I want you to do is not make it worse. You've just ripped a muscle, right?
Yeah.
It's bleeding. Don't stretch it. Everybody wants to stretch
If it's
it.
bruised, it's bleeding. Is that the
That's what the
theory?
bruising is. Remember talking about the cutting the steak and the
Yeah.
juices. So bleeding has to be controlled. Compression, like a tight wrap and ace bandage, like a bicycle short, something that compresses
Yeah.
is very important to stop the bleeding.
Okay.
Stretching it more is what you'd think, oh, it's tight, I need to stretch it. That's
kinda
the worst
thought-
thing.
I would've thought of that,
Worst
yeah.
thing you could do. So I want you, before you start saying what I need to do to get better, I want to stop the bleeding.
Yeah.
I want to stop the damage and tell you to stop playing. You're not going to be playing for a few weeks minimum with a muscle injury. It's just everybody thinks they're going to be right back the next game. We've all got, well, some of us do, have fantasy teams, and players that get muscle injuries account for the majority, almost a fourth or more of all injuries that happen in a season to a sports team. So the recovery period is varied based on what's wrong, but the key is to start with don't make it worse in the beginning.
Okay.
And-
In that case, let's
and
set
that's
a.
where Dom then is going to tell you, let's not go home and start stretching it. This is what you should
Yeah,
do.
but
More importantly, this is what you should not do.
What about when I was a kid, and I know it was when you were a kid, just walk it off.
Yeah, but you're a kid. Thing you just said it. Kids don't get these. These are these are problems as we age. We sit in chairs, sit in our cars, sit at our desks. Our hamstrings, our Achilles. We had a podcast on ankle injuries, and the 2 foot and ankle specialists we had spent half of the time telling you how to stretch your Achilles, which is your calf muscle and the back tendon in the foot. So all these get tight, and frequently, like an injury to the calf will cause you to limp.
Yeah.
And then because of that, you'll start getting a problem in your Achilles or your heel, and you'll get a painful heel syndrome. So Dom should, give us some guidance on how the linkage, it's called a kinetic chain, between the hip, knee, and leg are all connected. And when one injury occurs, then down the road, down the leg, you can see other problems later if you don't address them or prevent them going forward.
All right, so I've done what he told me to do. I'm not making it worse. Now I've seen you. You realize what I got. Walk me through some of the things you're going to do to me and what I need to do at home and how long I need to do this process with you.
So everything is based on how you're recovering and how you present to me each time. So initially, I'm going to give you just real easy range of motion exercises so the knee and the hip don't get stiff.
Okay.
It's okay?
Is that something you're going to do in the shop? I mean, in the
Oh, yeah.
in the physical therapy room. Okay.
Yep.
So you're going to move my leg up and down. You're going to use your own hands to do that, or am I doing it on my own?
Both.
Okay.
But usually I want you doing anything that's active. So we don't want that. We want to protect the muscle as it's healing, but we don't want to shut it down completely. So whatever your body can handle that's not painful pain is telling you something's wrong. You're doing too much. So we try to keep everything below that pain threshold in the beginning.
Okay.
Once you get past a certain point where we know that the tissue initially inflames and all the stuff that's going there to try to heal, once that starts to calm down again, then we start working on a little bit more mobility, trying to get some of the muscles to activate in a way that's not painful. Because again, making those muscles contract, causing pain, you're doing too much damage again.
And how often am I seeing you?
It depends.
In a week, am I coming once a week, twice a week?
If you're not doing great, maybe twice 1 week, but I'd like to see you once a week.
All right.
And then if you're really good with your home exercises that I teach you, sometimes once a week, every 2 weeks, as long as you're managing it well.
Yeah.
I see some people 5 times over the course of 6 to 8 weeks, and they do great on their own.
So I guess I'm still a little confused. Other than making my range of motion good, are there other things you're going to make me take part of to kind of make this heal better?
Yeah. So the research shows that working on some of your core muscles,
Like what?
your abs, your glutes, things that are around the hamstring, will actually help your recovery later.
Really? Like doing push-ups? Not push-ups, but sit-ups?
No. So just teaching the muscles to engage while you're doing other activities like moving your arms around, or because everybody thinks of the abs and the core as doing crunches and planks.
Yeah.
And that's true. But we know that you can contract the abs and not do those activities and still make them work.
Wow.
So
okay.
retraining the muscles to fire the way they're supposed to around the injury is important. So I'll get you.
You can just lift your foot up onto a chair, and if you do those on each side, you're activating your abdominal muscles.
Yeah, you don't think that, but it's probably true.
It's really simple. You do 50 to 100 of those a day and get some rock hard abs or Terry at the beach. But I think what I think we want to do is say, how do we go down a path to know when I can get back to play? Because the coaches want to know, the fans want to know, the player wants to know, the parents want to know, right? So again, then we have to get into what's called a graduated recovery program, or how do you gauge return to activity?
But is this just a sports injury, or can normal people get this walking down the street?
Well, normal people do funny things. They get on ladders. They fall out of tree stands. They trip off stools.
Yeah.
They have injuries that aren't all sports related, but they pull a calf muscle and they can't walk. So what we're trying to do is say muscle injuries need to be treated the same no matter how they occur, because the key is to prevent more damage, to allow healing, and to not go back too soon that you tear more muscle fibers and miss more time from work, play, golf, sports.
Yeah, but let's just say it just happened. Do I go home and put ice on it? Do I put
Probably
heat
not.
on it? Do I take So what is the right thing to do if something happens?
Compression.
Just compression.
And there's some argument against ice in muscles. We like them on joints because they're areas where swelling can occur. But the key is to control bleeding, quiet things down, and not try to get back to do too much too soon. And again, go see somebody to find out what's wrong. I think the biggest problem we have as healthcare providers is getting an insurance company to order an MRI that we think needs to be done.
Right.
And if you're on a professional team, they're getting it done on that sports player the next day or that night.
But do I need to go through you to get to him?
Yeah. Yes. In Ohio, you do. In my state, there are places where in the military you can go directly to a therapist without seeing a doctor first.
Now,
And it's mainly because of staffing and how many healthcare providers you have. But in Ohio, we do that, and I'm on one of the state medical boards where there's an initiative to have therapists see people before doctors. And the problem is side pain that you think is a muscle could be a kidney tumor or something that maybe a physician should evaluate before
Right.
sending someone to therapy. So you there's a little argument on turf there of who sees what when. But sports injuries is what we're looking at today, or an injury from a fall down a step, or you miss a step. You're going to usually need an X-ray or an exam to find out what's wrong. Then we all can Google what the heck to do with it, right? Or now use AI, and somebody's going to give you some pretty good answers. But you still want to know that 80% of these are not going to have muscle damage, which is really good for the athlete or the person who's injured.
Sure.
Because the MRI shows swelling, what's called edema, that usually resolves in a week or two. But some of the partial tears can take weeks to months to heal.
So, Dom, what is, because you're a professional at this is where you know more than most people, right? What is the upside or downside to going online and using AI? Hey, what do I do for a hamstring? Are they getting good information that way, or are they not getting good information that way?
I think it depends. It depends on how they ask the question. But
Yeah.
AI does seem to have some decent information. Like I've done it myself. I've asked what to do for an injury, and it kind of comes back with some pretty basic stuff that's not wrong completely.
Okay, that's good.
I would discourage it because there's more that goes into assessing an injury than saying, oh, I have pain in my hamstring. What should I do? Worst case scenario, you could have an avulsion or a full tear like Dr. Urse was saying here. And that's something you just don't want to, forgive the pun, sit on.
So it
You
goes
like that.
from you go, okay, this is a PT issue. You're going to Dom.
Right.
It's not the other way
Now,
around.
there are athletic trainers. At most schools have an athletic trainer or teams, and they would be the sports medicine arm of that team.
Right.
And they would evaluate things also. But again, there's always a physician or someone overseeing the major injuries. Again, these are major, loss of playing time to a sports franchise and a team and a player. So there's a impetus to get that person back as soon as we can.
So what's the difference between a
safely.
hamstring tear and a Charlie horse? Because you'll see guys on the field grab.
Well, it's the calf. Probably the calf muscle would be more of what's called a Charlie horse. So
Yeah.
behind your calf of your leg, below the knee, most people, but other people have used the word Charlie horse for any muscle cramp. So if you get one in your side from, swinging a golf club, perhaps. So I think there's different names for different things. I'm not sure AI can help you with that, but I think the key is, no matter what the injury is, try to find what's wrong. You gotta. The good news about most of these muscle injuries, very few. There's less than a 20% recurrence rate for these.
Right.
The ones that do poorly are the ones that are the more serious injuries that are not. Can't keep my wife from calling though. So there's some of these are just not things we can always understand immediately without the right imaging study. And
So what are the questions I should be asking you, Dom? I mean, there's probably 1,000 things people come to when they have this issue, and they're asking you questions. What are the things most people ask you when they walk in the door that or Dr. Urse hasn't hit on yet?
How long is it going to take to be back to full function is one I get all the time.
And what is the usual answer on that?
Again, it varies based on the severity of the injury. If it's a light injury, it could be several weeks. If it's a bad tear,
Yeah.
you're usually back hopefully within a couple months. You may have symptoms
it's
that
not
linger.
days, and I try not to use the word days on muscle injuries. It's usually weeks to months.
I'm surprised.
And, one of the guys that's in the Ohio area, Ken Griffey, was a guy who had a muscle injury, and I think right after baseball started, which is in our springtime.
Right.
And I don't think he got back till after the All-Star game in mid-July one year. And it was just months because, an injury that's more severe can take longer to recover.
And what's the harm?
waiting.
But if I go out there too early, what happens?
It hurts to run. You have to be able to run from first to second base in baseball, or to run up and down a soccer field or a basketball court. Right?
But am I doing more damage if I go out there?
Yeah,
Let's
you're
say
ripping
should it be
them up.
2 months and I go out in a month?
Then you miss more time in the long run.
Okay.
And that's why return to sports is the toughest answer for any healthcare provider. Because we don't know that. Just like you don't know who's going to win the game tonight in a baseball game, right? It has
I know who's going to win the game.
No, you don't. You're going to lose. You're going to lose your bet. You'll wear a Blue Jays hat next podcast if they.
You have to buy it for me, but All right. So, what other questions have I not asked that I should have asked?
What modalities do we use to treat the injury?
Explain what a modality is for those people like me who aren't that smart.
And maybe a little bit about eccentric lengthening
Yeah.
and some of the ways to prevent this injury.
Yeah. So let's start with that, preventing the injury.
Oh, good point. Yeah.
You recover, you don't want it to happen to you again. What do you do? The biggest thing is just training sport specific or for the specific activity that you're doing. Okay. So you got to remember a lot of these come from a high velocity movement where you're kicking your leg really quick while your hip is being kicked.
Yeah.
And that's what causes the rapid stretch, but the muscle contracting. So you want to maintain a certain extent of flexibility, but also muscle strength. And then learning to move the way that you're supposed to in your sport. So if you're trying to cut or decelerate when you're sprinting, but you're not very good at controlling it, that's when you're likely to get injured.
Really?
And that's where he talked a little bit about your glutes, or those are your core muscles on the outside of the hips. So if your core strength is weak, your knees are not lined up correctly, and you end up with more problems with your ACLs or other injuries around the knee. So we talked about the connection between the joints, but what he's saying is sport specific. Like if you're a skier, you may want to do like exercises that bounce from side to side,
Sure,
like you would around a mogul. Same thing with hockey or sports that have certain movements that are more specific to that sport.
Well, football used to do the high steps. Remember the high steps?
You can also look at things like yoga, or you can have somebody kneel down on their knees, have someone hold their ankles in the back where their Achilles are, and as they lean forward, you're strengthening their hamstrings. It's hard to do, but it's a good way to really strengthen the hamstring muscles. So, what the sports team should be saying is, why are we letting a fourth of our players have this injury every year without figuring out the right preventative spring training exercises that we should be doing to avoid this? We're missing 80 games of activities in a season because of injuries that are going to happen to a team of 25 players.
You want to make sure you're warming up properly, staying hydrated.
How long? What's a good warm-up time? How long?
Enough to break a little sweat. Feel like you're actually warm.
Really, I do a couple of these. All right, I'm ready to go. And
No, any warm-up should be enough where your blood pressure's going up, that you feel like your heart rate's up.
Okay.
You're breaking a little sweat. That's why you see some of these teams on the field 10, 15, 20 minutes running, doing high knees, karaokes, butt kicks, things like that to warm all their muscles up in a functional way. Static stretching, where you're just kind of reaching and touching, isn't the best way to do it anymore.
Oh, really? That's what I do.
Yeah, well,
so much for that.
Good thing
I'd stop.
you showed up
Good
for this
thing you're
podcast.
here.
Good thing I'm here today. What? So instead of doing the old touch your toes or go as far as I can these days, what should I be doing?
Anything that's more dynamic, where you're maybe, it's not bad to do those. Let me start by saying that.
Okay.
But I would be doing something more like riding a bike, or with our athletes, we'll have them do where they're kicking their leg up, walking down the field, where Frankenstein
That's
kicks.
what I see. That's what we used to do in football. You do the high kick thing where you're, high step.
High knees, anything that's getting the muscle to work and getting a little more of elongated position.
Oh, all right.
So before we land this, because that's always one of your best questions,
It is.
we want to thank our sponsors, Ted's Salad Dressing. So that's one of our
I had the other day. It was
great
excellent.
dressings.
Yep.
And GWR Group, Stiefel Financial.
He must be going gangbusters with this stock market these days.
It's been a good
week. I just feel what's coming.
But the other thing I'd like to do is just, if you could remember three things about most topics a month later, then we've done a good job showing you that. And that is that hamstring injuries are common in sports.
Yeah.
They are usually not too serious in the long run, as long as they're addressed properly. Most of them don't have muscle damage.
Yeah.
And there's very few recurrent problems. I've had both my hamstrings injured in baseball. I'm still playing baseball. And one of them was really bad in the middle of the muscle, where I had purple and yellow coloration from the bleeding. And it was so sore, it took 6 weeks before
How did it happen?
walk.
What did you do that
I was
happened?
stealing a base from first to second.
Did you slide?
No, it was halfway. It was, as he said, when you go to run and you start that sprint and the muscle stretches too quickly against a resisted force, and it's just it drops you in the base. It dropped me in the base path. I was
Wow.
in the dirt. And the ball did go into the catcher, so I hobbled to second. and I said, I don't need a runner, I need a wheelchair. And I walked off with 2 baseball bats as crutches. And
wow. So you couldn't walk.
I felt like I got shot by a sniper. And the first thing I did is move my knee, and I said, it's not my ACL. I moved my ankle. I go, it's not my Achilles. It's definitely my hamstring. And it is a showstopper.
Really? I'm so surprised to hear that.
And then I had the other side a few years later on the sitting bone where it pulled off more up at the top, not in the middle of the muscle. And remember, just think of a barbershop strap. Those muscles are long straps. We'll have a few pictures people can refer to in the background of the talk today. But just realize these things are they're common. Don't stretch them when you have the injury. Control the bleeding. Like even a bicycle short. Or, ace bandages don't stay very well, but most people have a bike short, or they can borrow their wife's Spanx, or some of those little things Herbert Hoover used to wear. I don't know what he wore underneath, but I'm probably getting in trouble for that.
Yeah, FBI's knocking on your door.
But I do want to thank Terry and Tri-Level Productions for doing our podcast. He does a great job.
I want to thank this guy for showing up today.
Tom, we appreciate it.
We've never had a PT guy here before.
Thanks for having me.
We've had a lot of surgeons, a lot of doctors, but never a PT guy.
They are really
Good
the
to know a
key
PT.
to our success. They not only make us look good after we fix something like a shoulder or a knee or a hip problem, but they protect what we did so the people don't.
Is this covered by insurance before we say?
Oh, sure.
So
well,
when
there are issues with co-pays with every insurance. There are a certain number of visits. Sometimes people get restricted in each year. But we strongly recommend therapy almost all the time for the things we see, because many of them will help us avoid surgery. And then, that's really what we want to do is help the person get better with whatever their problem is. This problem with muscle tears is frequently a non-surgical problem. And rarely does it need to have a procedure. There's one last caveat I will say, since we've talked about PRP in the past. Platelet-rich plasma does have an indication for muscle tears and the treatment using some what are called anti-inflammatory and growth factors in platelets. It's actually a different variation. It's actually PPP, which is platelet-poor plasma, not platelet-rich, that works best on muscle regeneration and what are called myofibrils.
So would you inject that in?
You could do that in refractory cases of pain, or someone who you felt you wanted to have maybe a little quicker recovery because it was in the middle of a season and you wanted this person for the playoffs, and those are things that would make a decision process at a later time between the obviously the patient and the physician.
All right. Well, we're going to land this one, and we want to thank you for joining us. By the way, it's Halloween night, and you're the witness to this bet. So we'll see how this game plays out tonight. Dr. Urse, thank you again. It's always a wealth of knowledge, and we want to thank you all for joining us here on the Bone and Joint Playbook with Dr. John Urse. And we'll see you again real soon. He'll be handing me $1 or I'll be handing him $1.
Don't forget to like us on social media.
That's right. All right. Thanks, folks. Bye.